What we're going to talk about here is how to kind of adjust, correct, reset the upper cervical spine. I'm going to use this towel here. You can use like a gym towel or even a strap of some kind, as long as it's not too abrasive on your neck, or you can put it around a collar or to have a towel under it. This is a pillowcase, so basically pillowcase, I folded it into quarters lengthwise. So it makes a nice little kind of handheld rope here, nice and soft too, because it's a pillowcase. And I'm gonna put it across like a gym towel here. And I'm gonna take my hands, I'm gonna put one hand across and then the other hand on top. So the one that's on the bottom is gonna anchor to that same side chest. This one that's coming across here is gonna go on my cheekbone, so I don't wanna pull my jaw too much. And so as you can see here, the strap is basically snaking around my neck. And so what it's gonna feel like when I take up that slack is it's gonna feel like should feel like a nice gentle hug on my neck, but it's gonna be biased on this side here. So I can feel that there. Now, a couple of things I can do with this. I'm gonna guide in that same direction towards my anchor side as it comes across. And notice here too, if your head tends to tip in the same direction or if it tends to tip opposite. Now, if we're trying an upper cervical spine, oftentimes we want it to kind of tip opposite direction. So like so, okay? But if you have issues with dizziness, be careful with any kind of tipping of the head here and go slow in general. So I'm coming across here, okay? So you can kind of see that. Taking up the slack gently. Now what I'm gonna do here has to do with my eyes and the relationship to the small muscles here that help to stabilize my head on my neck. So think of like image stabilization for a camera to keep it from having a blurry picture. This helps if you're like at an intersection, driving, scanning back and forth, checking a blind spot even, or just in a grocery store, say looking side to side, scanning the aisles there, or in any number of other situations. But it basically helps to keep our head steady so that we're not like a bobblehead. And it helps us to focus our gaze on whatever it is that we're looking at. So it really helps to, and it also helps to regulate the information coming into the brain so it doesn't get overloaded and make you dizzy or have other kinds of disorientation type effects. So what I'm gonna do is do this, take up the slack just gently. I'm gonna look with my eyes in this opposite direction of where my anchor hand is for about 5 or 6 seconds. And then I'm gonna shift my gaze over the same direction, kind of here. And then I'm gonna gently try to guide, not force, but guide here. Maybe a slight side bend if you can tolerate it here. And then I'm gonna repeat. So about 3 more times maybe. Look to my opposite side and then coming back. Just gently, staying kind of tall with my posture. And a little farther. So it's very gently ratchet. And then if you want, you can go ahead and do the other side, but presumably the target side will be the tighter side, and we're trying to just gently gain some range of motion back without over cranking or forcing, and trying to basically recalibrate things between these muscles in your brain and your eyes so that when you do move your head, it's free and clear and smooth and doesn't make you dizzy or disoriented in any way.